healthcare system is broken, but it doesn't have to be. This is Revenue Cycle Optimized by Infinix Healthcare. We discuss the latest challenges in the revenue cycle space and provide actionable tips on how to overcome them at your organization.
Hello, everyone, and welcome to this episode. I'm Stuart Newsom, your host, and our episode today is titled Revolutionizing Prior Authorization in Orthopedics with Integrated Service Solutions. We'll be diving into how innovative approaches to prior authorizations are transforming workflows, boosting efficiencies, and improving the overall ROI for practices. Now, joining me as our guest today is David Cabasa, practice manager at South Shore Orthopedics. And David has vast experience in operational management and practice efficiencies. And he's here to really share firsthand his insights on how his team has navigated the complexities of prior authorization with Infinix Integrated Service Solutions. So how you doing, David?
I'm good, Stuart. How are you? Thanks for having me on.
Glad that you're with us. If you want to just kind of give the audience a little background on yourself, kind of what you do at South Shore, a little bit about South Shore as well.
Sure, no problem. Welcome, everybody. Thanks for jumping on. I'm David Cabasa, like Stuart said, and I'm the practice manager with South Shore Orthopedics. We're a private orthopedic group just south of Boston. I've been here coming up on 9 years. We have about 25 providers in our practice. We have 2 locations. Yeah, we've been with Infinix now for about, I think, 4.5 years or so.
Yeah, so you can tell with 4.5 years, you've got a lot of experience to tell about how that experience has worked out for you. So yeah, we're looking forward to doing a deeper dive into that today. So in this episode, we're going to focus on how Infinix experts, services, and platform transparency have addressed common prior authorization challenges. So David's going to share his journey, detailing how these solutions transformed his practice's workflows, how they improved the efficiency of his practice, the supporting staff satisfaction, which is all important as well, and delivered those measurable ROIs. It's all about ROIs. You got to be able to measure it and offering value with the insights for other practices. So with that, David, we'll just get started and dive right into some questions here. So first of all, and this is the question I always like to start with, is can you describe your prior authorization process at your practice before engaging with Infinix's services?
Yeah, I'm sure, like so many on this call, painful is probably one way to describe it. Frustrating. Never one of those things that you have staff lining up the door and really wanting to come to work to get on the phone with insurance company and wait on hold for hours at a time, or long minutes at a time, and then have to go through the whole process. So prior to Infinix, we had a lot of, so here at South Shore, the things that we primarily get prior authorized are our visco injections. We do not have therapy, so we don't have to worry about that. But it's mostly that the visco injections, we do not have MRI, and so we don't deal with that. But then really the surgery. I mean, surgery is the biggest piece for us. And that's why we were kind of, looking to begin with to make some changes. So, very frustrating process for our staff and our team. Had a lot of wasted efficiencies. It didn't matter how we staffed it. People were generally never happy when they had to do that, whether we had a team dedicated to always do it or whether different people would, be a part of the process from time to time. They wouldn't necessarily look forward to that day or that time period in their day when they really needed to deal with the insurance companies and go through the prior authorization process. So, like I said, we started with Infinix probably about 4 or 5 years ago. And, for me, from a practice management perspective, some of the challenges I had were that, I had no insight in terms of looking into the future, knowing exactly where we were today, how we were for surgeries that are coming up in the next week or 2 weeks or 3 weeks or even tomorrow, and what the status was. A lot of manual paper, many, many hands in the pot, staff member calls out and you're going through their desk and looking through their folders and their sticky notes and everything else, trying to decipher where things are at. So in so many other areas of our practice, through our EHR and our vendor relationships, we have so many other either automated systems or ways that we're using technology through, either vendors or spreadsheets or whatever, different electronic means. And it became pretty clear that it was going to be really hard for me to recruit and retain and keep staff needing to do this. I didn't see it going away. Now, hopefully, I know as we all know, there's a lot of legislation on the table happening currently in Congress, and there's been, big pushes by medical groups to make some changes. And I think we're all hopeful that that will happen. But in the meantime, we did not foresee a time when things were going to change much. And, but we needed to change something internally to make sure that we're able to be a little bit more efficient and be able to better care for our
Mhm.
patients.
Right, right. And I can tell you some of those challenges that you just stated are some very similar to what we hear when we speak to our clients and even prospects that we're speaking to as well. They come to this with us with the same issues, same problems. It just really resonates what you just said. I'm just kind of been nodding my head, going, yes, heard that before, heard that before. It seemed to be very, epidemic, so to speak, lack of a better term. I know that sounds like a scary term, but it is. It's an epidemic that I see when I speak to the healthcare community and the providers in general. This is a big problem and it's a big headache, and everyone's, doing the best they can, but is that good enough? So, I
Well,
don't
and
know.
Stuart, sorry to cut you off, but and for our patients, right? There's nothing worse to probably be in pain from some sort of, in our case, it's a surgical scenario. Be in pain, know that there's an option out there, that there is sort of an end in sight and an option available to you, whether it is through an injection or whether it is through a surgery. And knowing that you have a provider that can provide you with pain relief, you can make plans, with your family to care for you, coming out of surgery. And there's nothing worse to be all prepared and get that all set up. And then, 24 hours beforehand, say, we don't have a prior authorization yet. We need to, kick your surgery down the road a little bit further.
Yeah.
Terrible.
Yeah, it really is. And timing is always important too, because like if you're at the end of the year, like we are now, certain deductibles may be already maxed out. Well, that starts over next year if you have to reschedule it for the next year. So that even puts some financial burden in some cases on patients as well. So,
Sure. And from a practice perspective, forget about all the time and effort that goes into making it happen. But also from a provider standpoint, a doctor standpoint, they've got their day booked, right? They cancel clinic hours. They've got a full day scheduled to be in the OR. The hospital systems book their OR time and have nurses that are counting on a paycheck as well to make sure all this happens, and to know that you might walk in and say, hey, we have a plan tomorrow to have 6 surgeries. And then for one or two of them that get canceled, there's huge ramifications for that for yeah, patient clinically, for a provider, like, one of my docs, one of my surgeons, on how it's going to affect their day, but also for all the people in the hospital and the health system that are counting on those hours. And with margins being so thin in an ASC or in the hospital, that labor is sometimes, and
mhm.
it's a shame. So
It really is. It really is. So with those challenges in play, you came to Infinix and partnered with us 4.5 years ago. So if you could elaborate a little more on how Infinix is, partnering with us to manage those prior authorizations, how's that improve your team's workflow and overall efficiencies?
absolutely. Yeah. So like I said, for the most part for us, we start out with the surgical process. That's where we had the most volume. It's where we had probably the most vulnerability, or the biggest effect we could have on patient care and our staff, probably where we had the biggest, stressors. And so two things were important to me. Multiple things were important, but two that come to the top of my mind. So number one, how do I make the process less painful for everybody, but especially my staff that have to do it, so that I can actually have people that enjoy the work that they do. They can operate kind of at the top of their license or their top of their ability, and enjoy what they do. So I could recruit and retain and have consistency within my organization. And then the second thing was, again, having some sort of process or application or insight into being able to have some predictability in the current state, but also into the future. And so they were two things that were kind of really important to me that I saw were major business problems. I love workflows. I mean, that's one of the things that I really liked. I love technology. And so, they were two things as we were vetting vendors, and there's probably some other vendors out there that do somewhat similar to Infinix. And there's ways you could probably build a spreadsheet and track some of this yourself in different ways. But ultimately, we went the Infinix route because I was able to get a demo of the product. If I remember correctly, I think we were able to do a trial, a free trial for 30 to 60 days. I don't
Mhm.
know if you guys still have that availability, Stuart.
Right. There's a pilot program. Sure.
Yeah. So it felt like one of those, okay, hey, just take the dog home for the weekend, see how you like it. And you can always bring it back on Monday if it doesn't work out, right? Um,
Right.
And so I kind of enjoyed that aspect. And we looked into it. We did some work with the sales rep and said, here's what we're looking for, here's what we're trying to do. And we could, trial with just, even a couple providers and do a small thing and see if it worked. And so right away we had a lot of success. And I'd vetted some other, like I said, businesses, but I also had checked with a couple of different organizations across the country that were orthopedic, similar to me, that had good success with it. So yeah, we jumped right in and trialed it out. And so, it was as simple. In a lot of ways, it was pretty simple. I mean, anything is work. There's certainly a lot of things to consider. You have to go through workflows. You have to, have a good plan. You have to have your team on board. You have to work closely with the vendor and get the buy-in. But it really wasn't that difficult to, choose a couple providers, choose a couple surgical schedulers, and say, okay, tomorrow, instead of you picking up the phone and calling the insurance company to get that prior auth, instead you're just gonna, basically type the case into the platform, and then we'll be able to see it on that reporting list, and then you hit submit and wait for Infinix to do its thing and get back to us with a prior authorization, and potentially communicate back and forth if there's more that's needed, and then do it for the next one and the next one. And so, again, in that trial period, we submitted a whole bunch of cases, and I liked the idea of Infinix using the AI piece at the time, and they still had that, sure, but being able to get almost an instantaneous answer. And for us, we logged every case. And my staff would say to me, "Well, why are we logging a case for surgery when we know it doesn't require a prior auth?" And to me, it was like, because I want to see everything in one system. Because when I look at my physician's schedule for next Thursday, today's a Thursday, so it's a week out. I want to be able to see that he has 6 surgeries, and I don't want to have to decipher that only 4 of them need a prior auth, and I'm only seeing 4 in the system. I want to
Right.
see that he's doing 6 surgeries. I got 6 surgeries in the system. 4 of them required a prior auth, 2 didn't, but I can see that all 6 of them are approved, right?
Right.
So now I can move on to Friday instead of Thursday.
Wow. It's a great idea. And I can tell you what you mentioned earlier about spreadsheets and how people can create spreadsheets. And I know you say you like workflows. I bet this was just something that was like, wow, Christmas has come early, so to speak, right? And I'm sure that the job satisfaction for your staff just went through the roof and reduce that turnover that you were mentioning in earlier, like the frustration that you were expressing that the staff had, no matter how y'all would do it or put the processes in place, there was still that level of frustration. I'm sure that kind of cleared up based on what you're describing. I can kind of hear it in your voice.
Yeah, yeah, I'd be lying to you if I could totally tell you that my staff came in and said, "Oh man, I wish we could call 10 insurance companies today and wait on hold for a half an hour at a time."
Right.
Clearly that's, it's a joke, but it's the truth, right? And so just having that ability for them to feel like, "Oh my gosh, I'm more efficient," right? And for us, it was helpful because, look, I'm a middle-aged guy, I guess, and I like the technology, and I grew up with it. And we have, a wide range of, staff that are, young professionals right out that are way better than technology than probably you or I are. And then there's some that have been, in orthopedics and in our practice for 20 or 30 years that are a little less, don't like the change as much and a little worried, is this going to affect my job, right?
Hmm.
Am I going to be out of a job? And for me, it was like, no, you're not going to be out of a job. There's plenty of work here for you to do. You're going to enjoy your job a lot more because we're going to get rid of that stuff that you don't like to do. And so what ended up happening, instead of having, a number of people that had to all work on this process, I basically pared it down to one prior authorization manager that manages my whole clinic now for all of our surgical auths. And so we have about 13 or 14 surgeons, and there's other people that data enter. When we built some integrations with our surgical scheduling software so that, as soon as the surgery is scheduled, it'll automatically open up a case in Infinix. And so there's very little that needs to be data entered. So it'll just kind of start working on itself automatically. But for our rep, and I'll call her Jean because that's her name, Jean ended up being not like the person that does the work all the time, but ultimately the person that manages the process, manages the work, makes sure everything gets done. And so I think I would say she's much happier and enjoys her job much more. And it doesn't mean that she doesn't from time to time have to call an insurance company to work
Hmm.
something out, or get a peer-to-peer or provide support and do things like that. But that's a small fraction of her time now compared to what it used to be. And so she can look at 13, 14 surgeons, look and say, I can see all these cases that are already entered for the next 3, 4, 5 months. Know that for the next 3 or 4 weeks, 75% of them have already been authorized. It's Thursday afternoon now. There's nothing else that needs to be authorized, for the rest of this week. And there's only 3 or 4 cases for next week that I need to kind of focus on. So just to have that kind of relaxed feeling of being able to feel like, okay, I'm on top of this.
Right.
I can breathe. Yeah, things might come up, but I know where I'm at.
Right, right. And it seems, I know, with as Gene is basically appreciative too, that there's a team at Infinix that stands behind her. Can you can you elaborate a little bit on how that the impact of that has been for you? How has having that consistent team dedicated to prior authorizations benefited your practice operationally?
Yeah, absolutely. So it certainly started in the I'll say pre-go live process and during the sales process. We work with a lot of vendors, and so what's really important to me is that I know who my account manager is going to be, or that we're going to have one. Am I going to have an account manager? Do I have to call an 800 number? How frequently do we, meet and call and communicate with each other to make sure things are doing well, going well? What does the onboarding process look like? Who's going to be working on these things? If we have an issue, how do we deal with them? What's the process? So, things are always bumpy. Don't let anybody tell you they're not going to be, right? But
Hmm.
what I liked about Infinix was they had an SOP, a standard operating procedure, and they documented it really well. And so on their teams, and I'm sure you guys deal with some of the same stuff we do with training and retention and turnover and things like that. But I honestly don't feel like we feel that as much, because if you hire somebody new at your end, they can pull out the book on South Shore Orthopedics and go through it and says, okay, if I do this, this is what I do next. If this
Hmm.
happens, this is what I do next. And so we've successfully done calls on a monthly basis now for 4.5 years. Every month we'll get on a call, and sometimes it's, a 10-minute call, everything's great, and we hang up. And other times it's a half an hour, and it's how can we do more business? How can we improve the system? How's the integration working? What's going on? And if there's ever a time when we say we would like to make a change, then, Infinix is great about pulling out that SOP and saying, okay, before we make the change, you need to sign off that this is what you want changed. And that is something that, like, I feel so good about, because I think that that's led to a lot of success. And I know a lot of vendors don't do that.
Hmm.
So I think that that's helped us a lot.
It's a lot of collaboration. It truly is a partnership, not just a vendor relation. And we've had some other clients speak of that too, about how it truly is a partnership. So you're echoing, exactly what we want, which is to have that collaboration with our customers and our clients, because we want our clients to be happy and successful. So that's good to hear. Really good to hear.
I think for us, when you talk about the collaboration, to me, it hasn't just ended with the how it started, which was, just us doing prior auths for surgeries. Like I said, it morphed into us doing our visco process that way. So our medical assistants can now, input their case through there, and they don't have to spend time on the call. So they can just room the next patient and interview the next patient, and then check the system a couple days later and see that everything's been authorized. So they've enjoyed that. But we've worked with the company as a whole, through our account manager and through other people within Infinix, to say, well, how can we make this even better? How can we integrate it with our EMR, with a surgical scheduling platform that we use? How can we, automate things to make it even easier, or to improve reliability so nobody's fat fingering insurance names and numbers and dates of birth and things like that. Like all those little things that in a
Hmm.
manual process can slow up the system if there's a mistype.
Exactly.
So, I think, we've built a number of VPN connections with, between different technology solutions that we have. We've been able to give different people access to that sort of dashboard that I was talking about earlier, whether it's, surgical schedulers or outside providers or the hospital. They can have read-only access so that they can go and see, where things are at.
Hmm.
So again, I think it's that kind of collaboration to say, okay, it's not just about getting the prior auth done, but it's about fixing so much more. It's about fixing the workflow. It's about being more efficient. And I'll tell you, Gene was here when we went live, and she's still here today. So, she started
Good.
maybe a year before we went live, I think, and she's been with us now, I think, 5.5 years. And I don't know that I could have said that before in our previous process that people would have lasted that long doing just this role.
Wow. Wow. That's huge. That's very huge. And so another aspect I think you had mentioned earlier, it was like you expressed some frustrations over, well, where to find the data, where to find the information in various folders and whatnot. And Infinix has a dashboard, that kind of gives that transparency. So how does that data visibility through the Infinix dashboard help in managing and forecasting prior authorization needs?
Yeah. Again, as a practice manager, I'm overseeing a lot of different things. I would say I was pretty instrumental in doing technology projects for the company, but I'm not the billing manager. I'm not the prior authorization manager. I'm not working with this on a day-to-day basis, but I am responsible for all of it. And we have a team around here of managers that supervise Gene or that supervise the surgical schedules we have. Like I said before, different entities that care about where things are in a process. And so, being able to, for me to log in securely, two-factor authentication and get in and just, maybe save a dashboard and look and see, okay, how do we look for next week? How do we look for the next month? Are we on top of things? We do the calls every month. I don't jump on every call. I jump on a lot of them, but I don't jump on every call. But again, being able to share, me to have that insight, managers to have that insight to say, oh, you know what? Hey, Jean's going to be out for a few weeks on vacation or, has something coming up and she might be on FMLA or, something like that in theory. For them to be able to say, okay, well then let's train somebody else how to get in the system and, see what her views look like. Or if I have a surgical scheduler that supports 2 or 3 surgeons, how can I give them a view with that can be saved that's only looking at the surgeons that they're responsible for, that they
Mhm.
care about. And if they're covering for another one of their teammates, it's a surgical scheduler who's on vacation next week that also supports 2 different, surgeons. How can she just go into that person's and not profile, but log in through herself, but change the view to look at those 2 surgeons and see if there's anything that she needs to kind of deal with while she's covering for her teammate. So it's used at, the management level and the practice executive level. It's certainly used at the manager's level. It's used at the staff level. And again, having that insight lets us know, like I said, predictability. Is Gene going to drown? Are we going to, I mean, right now we're going into December, right? So not a lot of people, some people have a lot of surgery at the end of the month because of deductibles, but a lot
Mhm.
of docs and patients say, I want to wait until, after the new year. So this might be a slower period of year time.
Mhm.
But during those times when it's really, really busy, you know, if we can see where we're at and start to predict it a little bit more, then I can know, hey, we're going to need to get Gene some more help. And that's important for us too, so that Gene feels supported.
Right. So you can kind of gear up for and anticipate. So you have able to make adjustments and predict, where your resources need to be outlined based on the data that you'll see in that dashboard. So and you've kind of shared throughout the discussion some ROIs already, and you've also shared kind of how Infinix has helped. But can you share a specific example where, say, the use of Infinix's services have prevented delays or improved patient scheduling specifically?
Yeah, absolutely. I mean, a lot fewer cancellations than we used to have, for sure. Not to say that it doesn't happen from time to time, because, if anybody else is doing this from a surgical perspective, that patient comes in, requires a surgery, would like to have a surgery done, and the doc says, "Look, I've got an opening in about 10 days out, 11 days out." And we say, "Great." And so we'll log it in the system, we'll start working on the prior auth, right away. And then, but the insurance company turns around and says, hey, we've got 14 days to do this. And they might wait until the 14th day to actually give you an answer, right? So you get, when you're booking it 9 days out and you tell the patient, you tell the doc, hey, this may or may not get approved. We have no idea. It's up to the insurance company's discretion if it's non-emergent. And sometimes they'll wait that whole 14 days. But again, at least we have the ability to try to get it done. And occasionally, again, it has to be a peer-to-peer, or, they're most of the cases where it really gets missed, or things like that happen because we try to push something through that the insurance companies just won't deal with, because they say it's our policy is 14 days and we're sticking to that.
Mm.
Sometimes we're successful, sometimes we're not. But the ones that maybe we had previously where, you know, oh, this piece of paper got stuck in somebody's bag, or, got stuck to the back of another piece of paper and we totally forgot to get a prior auth on that and didn't have a number and you're struggling last minute. There's just so much more. I know I keep harping on this, but there's so many kind of checks and balances and ways to reconcile and say, okay, let's look at the surgery schedule for the next month. And this surgeon might have 30
Mm.
surgeries, and let's make sure that there's 30 surgeries that have been logged into Infinix. And if
Right.
there are, then we know what reconciles. If there's something missing from one or the other, you can kind of troubleshoot that. So yeah, I think that's one example of an ROI that makes a huge amount of difference. And so then, where's the ROI come from? I think it comes from training, retention, and turnover, right? How much does it cost to have to train somebody new? I think there's an indirect cost of just, employee satisfaction. I mean, how not only efficient can you be, but how enthused and engaged can you be as an employee if you're spending most of your time doing something you don't enjoy doing?
Right.
Like sitting on the phone with an insurance company and fighting with them constantly. I think there's a cost to Infinix, right? It makes sense, right? But I think that, we did it out and said, okay, well, we've probably saved multiple FTEs. And I'm not talking about turnover, just, we've been able to implement the cost of Infinix that maybe is, saved us an FTE or two, which then again is why we've sort of moved into like now doing it for our viscos. If we had MRI, we'd probably do it for MRI. If we had therapy, we'd probably do it for therapy for all the same reasons I've already talked about. So I think it can come from that, from a staffing and labor perspective. Again, a missed surgery, a canceled surgery, it has a huge effect on the practice finances. So being able to eliminate a lot of those makes a huge difference. Yeah, and I think it's just, it's the efficiency and the ability to give my management team the ability to help manage their own staff as well and feel comfortable that then allows them to, log in every week or every day or whenever they do it, look and see where things are and then move on to something else rather than, because it's at the click of a button, whether they're working from home or working in the office or sitting right next to the people, they can do that. And I think that's a lot more efficient. And from a management perspective, there's a ton of ROI there if the manager can get the answer they need pretty quickly and then use the other time that they wouldn't have had previously to focus on something else.
Yeah, that's awesome. Well, and that's all that I have for my questions. We're now going to turn it over to Q&A for the audience. And looking down, I do see this one question so far, and that is, what advice would you give to other practice managers considering integrated service solutions for prior authorizations?
I mean, we probably talked a lot about, a lot of that already. I probably just Nike slogan, just do it.
Right.
I try and focus on, at South Shore Orthopedics, what do we want to do? We want to do orthopedic surgery. We want to see patients. I don't want to be a prior auth company. I don't want to be a surgical scheduling company. I don't want to be an EMR. I don't want to be an IT company, right? And so I enjoy outsourcing, those components that can show me an ROI, that are subject matter experts, to let them do that. Is this stuff we could do on our own? Absolutely, we could do it on our own. We've done it on our own, right? But again, I wouldn't blink twice about saying, how much of an ROI we've been able to have. So, there's, like I said before, are so many opportunities out there to use technology for different things. And this isn't just, Infinix is not just a technology, right? The dashboard is a technology. The data entry point, the portal is a technology that's, connecting their EMR to Infinix platform or to a surgical scheduling platform. That is technology, yes. But behind that, there is a team of people that's working on getting the prior auth. There is
Mhm.
AI that's technology that's scrubbing things and always learning the new rules of insurances. And it's not something we talked about earlier, but yeah, is the AI always work right? No, because the rules are always changing and there's how many
Right.
hundreds of different plans out there and things like that. And so, it's the ability to, when you get it now or something doesn't seem right, it's working with the Infinix group to kind of tweak the AI and help it learn a little bit better moving forward. But there is still a lot of manual work that needs to be done on the side of Infinix, which is people calling and getting the answers and talking to people. And
Mhm.
so again, that's the other piece of Infinix that we really didn't talk about is there is a team of people that are doing the work. And so again, that's your bread and butter. That's what this company does. So it's a combination of the people, the process, the technology, the relationship. Like that's what I think Infinix brings. And to me, why would I not want to outsource that? Whether it's to Infinix or any other provider that really can do that same sort of stuff. Because to me, if we're not doing that, then it's probably getting in the way of us seeing more patients. Patient access is a huge issue all across the country, and we're no different. And so how do we get to see more patients, generate more revenue, get people back on the playing field, back to work, back to school, whatever it is, back to care for their mom or their dad. How do we do that? Because we're the only ones that can do that. So Infinix can't do that for us, right? Our doctors can,
Mhm.
right? So anything I can do to make sure that the things that will help our doctors see more patients, touch more patients, provide better access, I'm going to do it.
Right, right. And to your point, I mean, yeah, having, some resources at your availability that are skilled, trained, they understand the industry. It just supports Gene, right? But also it does require human touch. There are some prior auths that you can't automate, and there are others that you can. And so leveraging that AI, those RPAs, those bots, using machine learning models to facilitate that, it just kind of helps our team from an FTE standpoint as well. So it just makes it more efficient. So it's not just throwing it over the fence at Infinix and there's a group of people doing it. It's a combination. We like to call it orchestration here. It's an orchestration of all the AI that's involved, which is, cognitive AI, generative AI, all the automation with the bots that's going on, machine learning processes that's going on in conjunction with human processes. So it really takes that concert, if you will, to make it all work together and work, for your practices to help Gene, who is making sure it's all running smoothly for the physicians, for the patients, and ultimately for the entire practice.
Yeah. And right now it's what, December 5th, right? So we're at the end of the year. So we're starting to think about, budgets for next year and strategic plans and everything else. And, whether it's any executive, any company out there is always looking, especially at this time of year, like what does the future hold and what are our problems? And so I think, to me, we're all probably very good at identifying what our problems are, but I don't think we're always very good at taking a jump or next step, to try and help to fix them. I think one of the problems I have, and my team would probably say the same thing, is I probably try and fix too many problems at the same time. But I would say, try to keep working on something. Try and identify something, know that there's solutions out there, know that there's technology out there, know that there's ways to talk to a vendor and vet a vendor out there and maybe try it on for size. And it doesn't have to be, super painful. And that's why I say, like, just do it. And if it doesn't work, it doesn't work. But if you don't try, you might not know. And again, I can't say enough. And usually I've done some talks like this. And do I have anything to disclose? I don't. I'm not getting anything from Infinix to do this, but I do. I believe in their product and their service. I believe in a lot of the vendors we work with. And but yeah, I will also say though that it does take a commitment. It does take time. It doesn't happen without some work being put in. And so, do your due diligence ahead of time, make sure you plan and get staff involved so that because they're the ones, it's the genes of the world that knows what the job is. They know the questions to answer and ask. Get them involved in the process and then, support them in the training, understand that it's not going to happen overnight. It's going to be work for 3 to 6 months, maybe, depending on whatever solution you're going with. But put the time in up front, and then it kind of runs on its own after that. So.
Mhm. Right. Awesome. Well, you've given us a lot of insight today, David. We really appreciate it, sharing your expertise and your experience. And for our audience, we hope you've gained some valuable insights into how integrated service solutions can actually help with your prior authorization workflows, improving those operations, as David dictated and shared with us. And David, thank you for sharing your journey with us. It's very appreciative. We'll have you on again sometime, I'm sure. And for the rest of you, we look forward to seeing you next week.
Thanks for having me, Stuart. Have a good one and happy holidays to everybody.
Thanks for joining us. Subscribe to get notified when our next episode is online. For more information for how we can help you increase reimbursements at your company, check out our website at infinix.com. That's INFINX.com.